do a series of self-help exercises. I want to give you some free information about what are the most important things you need to do for certain pathologies. And today we're going to do low back pain. So one of the things that I am really big on talking to my patients about is the use of the transverse abdominis. A lot of people, when I say that, they're like, I don't know what that is. Well, the core muscle isn't your six-pack muscles. That really gives you no core strength at all. Doing a bunch of sit-ups isn't going to help your back. Actually, in a lot of cases, it's going to make your back worse. So what I have to train people on is like, what is the actual core muscles? There are 6 groups of core muscles. Your obliques, most people know those on your sides. Your diaphragm, your pelvic floor, those are core muscles. You got the multifidus muscles, those are the small muscles along your spine in the back. And then your transverse abdominis. Your transverse abdominis actually is this muscle that goes around your waist, and it looks like a natural weight belt. And so today I kind of wanted to show you a little bit of a way to kind of start working on that. In my opinion, when people are going through spine rehab, it's something I like to show them early on because it's going to be imperative for them to know how to do it later on, and it's going to take some time to get through your treatment when it comes to this difficult spine pain. So if you want to try this exercise, we're going to try to work the transverse abdominis. And there's 2 different ways I'll show you to do it depending on how comfortable you are. The most common way to start is on your back. Okay, knees bent, okay, back flat on the ground. And what you're going to want to focus on is your belly button and right along your waist, along your belt. 2 things you don't want to do. You don't want to hold your breath, and you don't want to cause pain. Okay, so if either one of those happen, don't stop doing it because you're probably not doing it right. And also, when you hold your breath, you're going to know it right here. You're either going to push out or you won't be able to even talk. But the way this exercise is meant to be done is you want to focus on your belly button, and you want to act like you're pulling your spine, your belly button, to your spine. And you should feel a contraction down low, right where your belt line is. And I'm doing it right now talking to you while I'm not holding my breath and doing the correct contraction. Okay? That's one way to be able to do it. Don't get frustrated if you can't do it right off the bat. It does take time. Most people can't do it right off the bat, especially if you're having pain. That's research-based. So you want to try to do the best you can to kind of feel the contraction down low below your belly button. And if you know what Kegels are, women do typically. They work your pelvic floor if you've had issues with, if you've had babies and you had your muscles traumatized by surgery or something like that. Kegels can also help with this to be able to help the contraction of this muscle. Guys can do Kegels. I do Kegels all the time because it helps me activate that lower muscle because I've had my own back pain. Another way you can do this exercise, hands and knees, get your back flat. Try to focus on pulling your belly straight toward the ceiling. If you need to do a little bit of motion with it, that's okay, just to kind of get the feel of it, but you want to do it mostly neutral and pull your belly up toward your spine, holding it down low. You'll hold it for 10 seconds, do it 10 times. This exercise is something I show a lot of my people with spine pain. I want to kind of give this out to you because if you're going to need spine work here soon, or if you're currently going through it, getting back to it, you need to practice this because you really can't get your core strong without learning how to do it. And it's a very important exercise to make sure you have good success. Good luck, and if you have any questions, let me know.